Good morning, good evening, and Assalamu alaikum. According to time zones of the world, we are able to organize the Olympic of Anesthesiologists during this pandemic. Thank you so much, the organizers. I would like to welcome you all in my presentations, pain education at low and middle income countries. I will try to my best to bring the reality in front of you all. Where I am from, this is the Bangabandhu Sheikh Mujib Medical University. It's the only university in Bangladesh. It's about 56 departments, and we have around the 563 faculties in our universities. Let's look at the present scenario of pain at present. The different reports and publications reveal that one in every 5 patients attended in the healthcare facilities with suffering from pain, chronic pain in his or her lifetimes. And behind these shocking statistics, limited resource, limited access to pain medications and pain medications. But in our parts, but opioid crisis in developed nations that are responsible. Low prioritization of our resources is also the major contributor for countries like us. But this is just the tip of the iceberg. WHO estimates that around 5.5 billion populations, 80% of that living in our low and middle income countries are suffering from pain in the low and middle income countries. And the most common cause is that deficiency of proper training and educations for the optimal pain management is the primary reasons of the now, what is the prevalence of pain in the different parts of the world? So far, the studies show that 33% of the global burden that remains in the low and middle income countries. In Bangladesh, in outpatient department of Bangabandhu Sheikh Medical University, around 90% of population presented here as a primary symptoms as a pain. In Sri Lanka, it is around 67% reported from the chronic pain. The landmark trial by the Wayne Morris and published in the British Journal of Anesthesia Education series in the year 2008. In this trial, the most of the common barrier of pain educations and treatment, the four main regions he has covered: low priority of the government, less access to pain medications, and interestingly, it is around 0.3% of whole pain medications. The lower patient's expectations and the attitude of the patient is also important. And most importantly, deficiency of pain education and attitude is the gap behind that. So I'm now coming up to my regions, the South Asian regions. The 1/4 of the global population lives here, and the 90% of chronic pains in Pakistan will coming to the general physicians, and 85% of them have the severe knowledge gap. In Sri Lanka, the scenario is not so good. The nurses involved in the cancer pain management, they do not use any clinical tools for pain management. So, as we tell that in the year 1846, this is the year the John J. Bonica and the Ether Day, the Massachusetts General Hospitals, we call it the Ether Day, 16th October 1948. And in this era, the blessings of the human beings, at the end of this epitaphs, we have seen that we have conquered the pain. On the other hand, John J. Bonica, the founder of ISP, is established the multidisciplinary pain clinic at his University, Washington, in the year 1976. And from that, the pain medicine and pain educations keep as causes the momentum. In the year 2017, there is another milestone publication is that the pain educations, though, is a disastrous omissions of the educations in the pain practice. Now we have did a landmark trial on the pain curriculum in Bangladesh, the undergraduate, postgraduate, and nursing curricula. In the postgraduate curricula, only the anesthesia neurosurgery, and palliative medicines have got their sufficient curricula in on pain medicines, but in the undergraduate level is very deficient. Is around 2.6% only in their total times. That is the 19 hours out of the 7,000 hours in their 5 years period. But the nursing curricula is slightly better. It is around the 25 hours out of 2,400 hours in their total curriculum. This is this is the curricula in the underdeveloped countries like us. But what about the developed countries? They are not different from us. In US and UK, they have the deficient pain medicine educations, other than the Australia and New Zealand. In the UK, it is around 13 hours, but in US, it is only the 9 hours. The Michael Bond, the published a landmark trial in his journal, the British Journal of Pain, and he stated that despite the 30 years of pain education program, the 18% community of Western countries are suffering from the pain. So this is the shocking news. Then what about the global initiative? The IASP and the World Federation for Anesthesia, they have come forward to make some global initiative in the field of pain education, in the field of clinical training, and also in the advocacy. To fulfill this criteria, 2018, the IASP declared the Global Year for Excellence in Pain Educations to come forward on the advocacy part. As part of the global initiative, the International Association for Study of Pain, they have recommended the outline of curriculum for pain medication. On the other hand, one of the federation, the AFIC Federation, they developed the pain curriculum and conduct the European Diploma in Pain Medicine since 2016. The European Society of Regional Anesthesia and Pain Therapy, they have also developed their curriculum and conduct the EDPM program since the 2019. But we have started our essential pain management program, though this program is started here in the Papua New Guinea with the help of IASP, WFSA, Australia and New Zealand College of Anaesthesiologists and other private donors. And now this essential pain management program is active in more than 30 countries. Bangladesh is also the part of the EPM since 2013. And so far, we have trained around 404 doctors and nurses. Out of that, the 33 Bangladeshi instructors who have trained, and we have organized the 28 courses so far. But what about the initiative in the South Asian regions? The Aga Khan University in Pakistan introduced the fellowship program in the medicine in the year 2015 to meet this challenge in these low and middle income countries. And International Indian Society for Study of Pain, they have also introduced this pain medicine curricula in the year 2018. In Bangladesh, the pain medicine curricula is established here at Bangabandhu Sheikh Mujib Medical University in the year 2020, and they have developed a 1-year-long pain fellowship program. Thank you. And on the other hand, the IASP developed with the SARPS Federation, like any other federation. The BSSP is established in the year 2003, and this official federation is recognized by ISP in the 2020. And we have the 5 members, that's Bangladesh, India, Nepal, and Pakistan, with the goal to patronize the pain education and advocacy in these South Asian regions. So let's see how we developed. We have started the pain conference biannually, and it starts in the 2006. And in the 2006, we have only the 180 participants, and out of that, 87 is the trainee participants. In the year 2018, we have the number is around 2025, and most of the participants are from the young pain physicians, and it is about 184. It is the landmark identifications because of that advocacy program. So we are published our research work in the South Asian regions, and we have published the three journals in these 12 countries. What about the post-COVID era? In these pandemic regions, causes the diversions of the resources, the increase the number of patients suffer, and jeopardize the ongoing skill development. This present pandemic exposes the gap between the people expectations and the on-ground reality of present in the healthcare systems. I'm afraid the post-COVID warriors may suffer from post-COVID pain and functional disability, worsening the current pain condition. So, to improve the current situation, we must come forward to take the international initiative to overcome the burden out of the regions, financial capability, and religious and political belief. Thank you all for the precious sharing. Thank you, organizer, for giving me the opportunity. Thank you.